Vote coming up about noon San Diego time.
And we are catching up once again with Representative Brian Bilbray on the phone with us this morning from the 53rd District. Good morning.
Yeah, it's the 50th district.
50th. Oh, did I say 53rd? Sorry.
Congressman, it looks as if this thing is going to pass. The Democrats have put all of their eggs, if you will, in this basket. They pulled out the president yesterday. They're going to get the votes. It appears they will anyway. Isn't it time for Republicans now to move on and look for ways to, as you, I'm sure, would put it, fix it after it is passed?
Well, the first thing we'd like to do is to make sure that a bill that's this momentous, that we take the time and have each member vote on this item and stand before the House and stand before the American people and vote either yes or no on this, and do it personally, not do it electronically. And that is something we'd like to see. The other thing,
now, the Republicans have asked for a roll call, right? A public roll call.
Yeah, and this will be the first time that we've had a major piece of legislation like this that was not a bipartisan effort. I mean, Medicare had massive amounts of Republican support in there. It was a bipartisan, but this one is sort of interesting, and they're doing it in an interesting way, too. What they're going to do is, instead of amending the Senate bill and then passing it, they're going to have a group of basically a wish list of things they would like to have changed, but then they're going to vote on the Senate bill as presented without those amendments. So, in other words, we're being asked to vote for a Senate bill that has all the backroom deals, like for Nebraska being exempt from the taxes, and while Californians are getting double hit, the Louisiana purchase deal, what they call the Gatorade, all of those Senate-backed deals will still be in the bill when we're asked to vote for it, no matter what we do with the wish list, which will be the second vote. And in other words, what they're doing is they're going to have a wish list and send it back to the Senate, and, oh, please, would you change the bill after we've already voted for it? Which it's extraordinary.
Right. You're skeptical that can occur at all.
Oh, especially in the Senate. I mean, my God, you've got senators who make a living off of making these backroom deals, and the only way to stop them is to just stop the bill until they're taken out. But to pass the bill with them in is something I just think that you talk about wishful thinking, let alone trying to sort of reinvent the wheel. And why they're doing this is because the election in Massachusetts has changed their formula, where these deals will fall apart if they try to do that.
So the American people are looking at noon today of having a health care reform bill that still has to go pass some muster in the Senate, and of course still has to be signed by the president, but will be signed. You're seeing it, though, as something that is probably going to have to be deconstructed using legislation over the next decade or so.
Oh, it'll be more than a decade. We're talking about a process that will have to wait until somebody has a supermajority and in the Senate, 60 votes, which the Democrats don't have now, and we'll have to have the White House and the House of Representatives. So, this will be a once-in-a-generation issue. It's something that we just got to remember. This is why be careful of what you ask Washington to do, because it's unlike the city council or the county or the state that can actually change it once they do it. Washington does something. It takes a generation to finally get it straightened out, and that's what's kind of scary about this.
All right, Republican Representative Brian Bilbray from the 50th District.
You got it right.
Thanks for talking with us this morning. I know you're just probably about to go in shortly and prepare to cast your vote.
Well, absolutely. And, let's remember when we talk Democrat, Republican, when we're in the House of Representatives, we represent all the people, and hopefully we'll hear that today. But maybe they'll allow us to have our voices heard at least when we vote one way or the other on this bill.
What a day in Washington. Congressman, thanks for joining us.
Thank you very much.
3 votes today they will take.
Yes, 3 votes. One on the rules, one on the reconciliation Band-Aid, and then one on the Senate bill itself. And then the president undoubtedly will make some comments from the Rose Garden.
All right. And, of course, we'll have all of that covered later today on the KUSI News at 6, 10, and 11.